Hello everyone, my name is Morten Tyrberg. I'm a clinical psychologist and a PhD student at Stockholm University.
And my name is Tobias Lyndgren, and I'm a research group leader at Karolinska Institute and Morten's supervisor.
Yes, for my PhD thesis. We have been invited by the Journal of Contextual Behavior Science to discuss our recently published article called Usefulness of the ACT Model for Nurses in Psychiatric Inpatient Care, a Qualitative Content Analysis, that we published together with our third co-author, Carlbring, professor at Stockholm University. So in this talk, we're gonna talk a little bit about the contents of this specific article, but also broadly discuss the values of using qualitative methods in research. So just briefly, this article is an interview study where we talk to a group of psychiatric nurses at an inpatient ward that had participated in a series of ACT workshops aimed at teaching them a tool for speaking with patients and also a tool for handling their own work-related stress. What we found using a qualitative method called content analysis was that this simplified ACT model seemed to be useful for these nurses as a tool for helping patients deal with their symptoms, as a tool for sort of deepening the conversations that they had with patients, adding a bit more quality to these conversations, and also as a tool for handling stress within themselves. Besides this, results also revealed some difficulties in using this model. These difficulties had to do with time, the lack of time for using a psychological model in the inpatient context, and it also had to do with in some cases difficulties understanding this model, and also having to do with patients' severe illness. So this is just briefly the results from this particular study. The broader project that this study is a part of has to do with how we can implement psychological treatments in different ways in a psychiatric inpatient context by using traditional individual therapy or by using staff training, as in this case. To me, the reason we used, just to broaden the issue to speak a bit about qualitative methods at large, the reason that we used this method, to me, was that it seemed an intuitive way of just simply asking the participants what they think about the model. That's basically what we've done if you look at it in a simple way. But using this method, qualitative content analysis, we've also done this in a way so that the research can be reproduced. And we've done this by adhering to the standards of trustworthiness that are laid out for this method. So credibility, transferability, dependability. So that's my thoughts.
And to this project, it's also a way of combining the everyday clinical work with the academia.
Yes.
So one part of the overarching goal of this project has also been to find ways to use research methods in everyday life to actually make treatments and the work with patients better and evaluate the effects, to find ways of using research methods in everyday at an everyday clinic, which I think is a really important work for us,
Sure.
academics and clinicians, to find ways to make 1 + 1 become 3 instead of just acting, either as a clinician or as a researcher.
Yeah.
Also, I think for your PhD training, I've never used qualitative methods, only quantitative methods. So for me, this was a learning experience as a supervisor. You are much better on this than I am, but I think it adds knowledge to to the actual thesis, that you use different methods to find knowledge and development. So really, and also I was surprised of how much I think of this that the knowledge that we found from this study was actually useful, and it added to our ideas of how should we make this even better, how should we do this if we would do it again,
right.
how we would do it differently, and also just hearing the staff that we trained to talk about how they are using it. Some of what they said was surprising. Okay, so they're using it that way,
yeah.
And that we wouldn't have known if we hadn't done this study.
Right.
So good for PhD training and a way to combine clinical work with academic.
Absolutely. Absolutely, I totally agree. It's as a learner of research, it's really a good way to look at the research question from different angles, using both quantitative methodology and qualitative methodology, as in this case. And then just summing up, I think for both me and Tobias and for Per as well, this project has been a lot about, really for us, learning stuff. I mean, our values going through this have been to learn and also to be of maximal use and make a long-term difference for those we work with. And this has been, I think, a contributing part to this. So as an advice from us, if you haven't tried it, try to use a qualitative methodology for your next study and see what you find, right?
Absolutely.
Okay. Thank you.
Thank you.